Good afternoon, everybody. Doc Dave here, episode number 38. This is going to be a very interesting one because we've all, have heard about this in the past. Some of us have been exposed to it. Some of us have been treated for it. But I think it's information that's necessary and educational and preventive in nature. And it's about STDs, sexually transmitted diseases. Now, basically, an STD is an infection that's transmitted through sexual contacts secondary to either bacteria, viruses, or parasites. And we'll go over, pretty much all of these in this lecture. So, the first one I want to discuss is the most common STD, and it's been, gotten a lot of notoriety over the last 10 years. Wasn't really noticed that much prior to 10 years ago, even though it's been around for a long time, but it's been brought to attention, is HPV, human papilloma virus infection. And the reason it's been brought to notoriety is because a new vaccine came on board about that time, maybe 10, 15 years ago. And it's been very effective for the serious type of HPV. Now, there's over 100 types of HPV viruses. About 90% of them are, pretty mild, relatively asymptomatic. They resolve spontaneously, which means they don't need to be treated, usually within about 2-year period of time after being infected. It's the 10% that cause the problems, and you don't know which one you're going to get. So that's the problem. That's why everybody is recommended to get vaccinated, especially boys and girls and people in their teens and going off to college and becoming sexually active. So that vaccine will prevent the 10% that could cause the genital warts and even worse, cervical cancer. So that's why you get the vaccine, not for the 100% of them, the 90% that just go away by themselves, but the 10% that can be very serious. So, what is an HPV? Well, it's a virus, obviously, that's what the V means, and it causes, warts, genital, and then it can cause the cervical cancer that I mentioned. It's the most commonly transmitted sexual disease. It's usually asymptomatic, but it's still contagious. So you can have it, you don't know you have it, but you can spread it. There's no real cure for it. Like I say, the top 90% just kind of go away after 2 years spontaneously, so there's no cure. And even the 10% that are really cause significant problems like cervical cancer, there's no real cure for those. That's why it's important to be preventive. Preventative cure with the vaccine is the cure for HPV. You got to get the vaccine first to prevent the disease. The vaccine is not going to cure the disease if you already have it. So, the treatment, well, the treatment is basically, over-the-counter kind of stuff. If you get little sores, you can put ointments and stuff on them. You could take anti-inflammatories, you can stay hydrated and stuff like that. But and there are some treatments for the genital warts. It's something that called gentian violet. I don't even really know if they have that anymore, but that's what we used to cure it with way back in the day. It's just like an ink ointment you put directly on the wart, and it'll cause it to, dry up and go away. So, how do you get it? How do you get HPV? Well, it's pretty straightforward. It's skin-to-skin contact, either vaginally, anal, or oral. Those are different ways, that you can have the contact and pick up the HPV. Yeah, everybody just thinks it's vaginal, but if you do other sexual involvements, then you can get it either anal or oral as well. Now, other than the vaccine, how do you kind of prevent this? Well, safe sex. You limit the number of sexual partners. You wear condoms. That'll protect you as well. Early diagnosis is really important. That's why women are recommended to get Pap smears to rule out any cervical cancer if you have asymptomatic HPV. So you get your Pap smears, your doctor sets it up for you every year or every 2 years, depending. So the big complication is, if you're not careful or you're not aware of it or you haven't been vaccinated, is it can be passed in pregnancy through childbirth. So you got to be really careful with that. And if you got exposed warts and they haven't been treated, then you got to get C-sections. So that's pretty much what you need to know about HPV. It's just to summarize it, the vaccine will prevent the 10% of the HPV that causes the warts and cervical cancer. That's why you get vaccinated. Okay, the next STD is chlamydia. Now, chlamydia fortunately, it's a bacteria, not a virus, so it can be treated with antibiotics, which is good. The symptoms of chlamydia, usually you have a discharge. It's itchy in nature. It could be men or females getting the discharge. You can get dysuria and frequency, meaning painful urination and frequent urination. You can get testicular pain. You can get rectal pain. You can have a sore throat. And it's usually diagnosed very simply with your physician can do this, even with just a urinary sample. Now, it's like I say, it's a common bacterial, not viral infection. It's spread via sexually transmission, obviously, and it's through vaginal fluid or semen from the male or oral saliva or even sex toys. So if you use them, you got to clean them. The treatment is generally for the initial disorder, not the reoccurrence, but the initial time you get it, is an antibiotic, one dose, either of Zithromax or of doxycycline, but your doctor will have to prescribe those for you. Now, if you have recurrent infections, then you got to take a 1 week supply of antibiotics. And then you generally have to be retested in 3 or 4 months to make sure that the reinfection has cleared up so you don't get reinfected again. You got to do partner notification, because if you don't notify your partner and he or she has it and you treat yourself, then you're just going to get the reinfection again. That's how you get reinfection, because the initial treatment's really easy, just 1 dose of an antibiotic. So the compliance rate is obviously 100%. So the reinfection comes from either not notifying your partner or your partner doesn't get treated. Complications from chlamydia. In males, it's epididymitis, which is an infection in the testicle, quite painful. You want to try to avoid that if you can. Females, it's PID, or pelvic inflammatory disease. Problem with this is not only is it painful, you can get fevers, you can get sepsis, but you can also become infertile. And you can have increased ectopic pregnancies because you get scarring in the fallopian tubes, so the eggs don't pass enough to keep you fertile because they get blocked off from the scarring. And the ectopic pregnancy can cause the pregnancy to develop in the fallopian tube due to the blockage. You can also get something called reactive arthritis. You can get conjunctivitis, which is like a pink eye, and you can get proctitis if you're a male, which is an infection in the prostate. None of those are good, so trust me, if you get the infection, treat it right away. The third STD I want to talk about is genital herpes. It's very common. It's a painful genital sore. It's your skin around the sore, or even if you don't have the sore yet, it's very sensitive, feels like pins and needles on the skin. You can get a rash with it. And it's obviously secondary to sexual contact and even kissing if you have the oral form of it. Now, it's self-diagnostic, pretty much so. You get painful ulcers, you get a fever, body aches, fatigue, you kind of flu-like symptoms, you got something going on. Then this little genital sore shows up and bingo, you made the diagnosis. Now, this can lie dormant for years or decades. And if it's going to be reactivated, it's usually by a number of things. First of all, a weakened immune system. Like if you have another disorder in your system that weakens your immune system, you're going through chemo, you got a cancer, you got a leukemia, you got HIV or AIDS. Anything that weakens the immune system will reactivate the herpes virus. Stress and fatigue can cause it as well because that dampens the immune system. Sun exposure, especially on the lips, you get those cold sores. That's what it is. That's a herpes type disorder. Not necessarily sexually transmitted, but you have it in your system. And so that's pretty much how it presents. How do you prevent it? Well, condoms are very helpful. Limiting sexual partners is very helpful. And just common sense, if you happen to be with somebody and they got a cold sore on their lip, probably not a good idea to kiss them or have any kind of oral sex. Treatment, well, it's an antiviral. It's something called acyclovir. But, obviously your doctor gets involved and prescribes this for you and follows this up for you. Obviously you avoid sexual contact during that period of time. It's not necessarily treatable. It's not it's not necessarily cured, but it is manageable. So, that's where you use the antivirals, the condoms, reduce your sexual exposure. And you can also pass this through childbirth, which is very devastating. So you want to try to avoid that. And if you have it, you're probably going to have a C-section. Number 4, gonorrhea, what they call the clap back in the days. It's a sexually transmitted bacterial infection, again, which is important because it can be treated 100% with antibiotics from your physician. The symptoms are, again, dysuria, painful urination, frequent urination. You get a discharge from the penis or the vagina. You get testicular pain. You get pelvic pain if you're female. Dyspareunia, which painful intercourse. Fever, and pussy discharge. Usually it's clear, but it can be greenish, and a sore throat if you have the oral form. So like I say, the treatments are, you get tested, doctor does, a smear test on you and treats you with an antibiotic for 7 to 14 days, usually something called Cipro. Now, complications of gonorrhea, if you just either totally ignore it or you just, don't figure it out, it's asymptomatic initially, who knows. But if it's untreated, you get PID, which is a pelvic inflammatory disease in females, and epididymitis in males. You can get infertility for females and ectopic pregnancies for females, similar to the prior STDs. You get joint and heart disease, endocarditis of the valves. You get urethral strictures, so you have decreased urination. Meningitis can happen as well, and it's very dangerous and fatal. Increased risks of HIV and AIDS, and the baby can be blind if it's born through the birth canal and it hasn't been treated. So a C-section will be in order there as well. Prevention, condoms, testings, and antibiotics. Be careful, know your partner, get tested if you're concerned. Use condoms for prevention. So, there are ways to prevent this, so, use common sense. And the last one is syphilis. It's a bacteria asymptomatic infection. Symptoms are usually painless, and it has a firm lesion, and it's usually non-itchy. It's a skin ulcer with secondary swollen lymph nodes. And it can be treated with antibiotics if caught early enough. It is a treatable disease because it's a bacteria. There are 3 stages of syphilis. Usually, nowadays we only see the primary syphilises, but in the older days you had secondary and tertiary syphilis. The primary is basically a painless sore, or what we call a chancroid. It's like a pimple or a blister, and it can resolve spontaneously, but it's still contagious. And you get secondary swollen lymph nodes, usually in the groin. Secondary syphilis was a rash, non-itchy, generalized, usually in the palms of the hands or the soles of the feet. You get fever, fatigue, sore throat, headache, myalgias. You just feel lousy, flu-like symptoms, and swollen lymph nodes. And the third one is a tertiary. Like I say, we don't see that much today. It's life-threatening complications, neurologic, cardiovascular, and organs, systemic organs. So that's pretty much your common STDs. You can also have things like hepatitis B, but we won't go into that into detail too much now, but everybody pretty much knows what hepatitis is. And then you're obviously HIV and your AIDS, which everybody's pretty familiar with, and I'll do a separate podcast on that because it's a little more time consuming. So there you go. There's your STDs. I hope this was educational. Hope you enjoyed this. This is information you can share with others, especially if you have partners, so everybody understands the different exposure diseases you can have. And if you like this, please hit the like button and subscribe, because I got a lot more good episodes coming down the pike. And again, remember, I am your friend, but I am not your doctor. So if any of this shows up, get tested, get treated, and you'll be educated by listening to this podcast, so you know what to do. So thank you for your time, and I'll catch up with you again very shortly. Have a good day.